Hello, I am Anika Femila dancing, presenting my report for equine rabies, also known as Lissa or hydrophobia. Acute progressive fatal encephalomyelitis is better described as a sequela of equine rabies rather than another name for it. So it's very rare for horses to contract rabies tungod kay strict vaccination protocol against rabies in most countries. So it is also one of the core equine vaccines. So rabies is caused by a virus. As seen in the picture here, it is a large bullet-shaped virus from the genus Lyssavirus, from the family Rabiviridae, subgroup rabies virus. So the name derives from the Greek Lyssa, meaning frenzy or madness. So as mentioned previously, it is rare because of vaccination. So depending on the source, some sources will say 2 to 9 weeks, some sources will say 2 to 6 weeks ang iyang incubation period. So as we know from other species, it occurs by the bite of a rabid animal. So dito siya mosulod sa subepithelium and striated muscle. So ang pathophysiology, it starts to spread centripetally dito sa site sa inoculation, and then musaka siya sa neuronal axons to the CNS via the spinal cord. And then after that, maabot siya sa limbic system. Dito siya mo replicate niya kanang mm, mo, ang kaning cortical control kay ma-release, and then muna ang kanang start sa furious form sa rabies. So rabies comes in three forms, and we will elucidate that later. So spread siya, continue siya og spread sa CNS, and then maabot siya sa neocortex, replicate siya, and then dili na pod magsugod ang dumb form sa rabies. So first kay furious form and then ang dumb form. So gikan sa CNS, mo move siya sa peripheral nerves, and then maabot siya sa mga body organs. Ya kanang eventually maabot siya sa salivary gland, and then kanang magsugod na hinuon siya og ang mga virion musugod siya og release dito sa saliva. So which is why um dito matransmit ang rabies sa bite. So progression of clinical signs is rapid. Some I have seen a source which quantifies the actual rate at which rabies progresses. It's mo go up ang viral particles or virions sa mga peripheral nerves at about 3 millimeters per hour. So that's actually pretty fast. So pwede siya musod sa actually ikapaak, pwede siya mo enter sa peripheral nervous system, and then anam-anam siya abot sa brain, and then mo replicate sa muscle tissue. So kanang after that maabot siya sa other organs, and then ang kaning susceptibility sa infection sa rabies kay daghan nay mga factors such as kanang unsa siya nga variant sa virus, unsa kadako ang concentration sa inoculum, and then location. This is important, location kay need pa ba siya magkanang mag travel from peripheral to CNS, and then severity sa exposure, and then of course ang immune status sa host. So, nasa predilection sa brainstem, hippocampus, and hypothalamus because it is a neurotropic virus. So, all ages, even neonates, may be affected. So, na-mention na nato previously nga na three forms of rabies: furious form, paralytic form, and dumb form. So, sa sige na ko ganang pangita sa kaning references aning subject. They most of them mention one thing nga rabies can look like anything, and it may be difficult to diagnose. So the difficulty not only starts with the clinical and pathognomonic signs, but also how to diagnose, how to actually treat it. We will get to that later. So pwede na po siya, actually, it's really difficult to discern this from other diseases kay kanang mo present siya og classical signs of neurologic disease, yeah, kanang na behavioral changes, and then pwede po siya ma-attribute to lameness and colic. So let's discuss the three forms of rabies. The furious form kay usually science ani is or sorry, aggressiveness, and then mo-attack ra sila indiscriminately. However, this form is usually mas makita nato sa dogs rather than sa horses. And then kaning sa paralytic form is the paralysis sa kanang spinal cord. And then kaning dumb form, usually ang makita ani is kaning magdrool ang horse, and then paralysis sa pharynx, and then depression and also anorexia. So usually mo ni ang form nga makita in horses. Pero in general, notwithstanding sa kaning three forms of rabies kay naay signs such as ataxia, fever, and hyperesthesia, or in this case sa mga horses, hyperesthesia sa sensitivity to touch. And then usually recumbent sila, and then naay loss of anal sphincter tone. And then magsweat sila, may muscle tremors, kay muigo man pud siya sa kanang striated muscle fibers, circling, head tilt, teeth grinding, and abnormal vocalizations have also been described. So some but not all become comatose or experience seizures. And then death is usually related to cardiorespiratory failure. So we've discussed man nga kanang maabot siya sa organs. So tungod kay maabot ang I'm sorry, kanang ang kanimanggong rabies virus not necessarily nga mo directly destroy siya og mga cells. However, ang kaning death usually related to cardiorespiratory failure is because kanang it is caused by kaning anoxic or ischemic injury sa cerebral cortex, sa hypothalamic control center sa brain. So it is a result of some other event rather than the cells being destroyed. So Negri bodies, which are most commonly found in the hippocampus and Purkinje cells of the cerebellum, are pathognomonic for the disease. So naa diri sa graphic ang Negri bodies. So mo ni kaning mga round eosinophilic cytoplasmic inclusions. So mo ni kanang ang ilhanan or like differential para sa rabies. Mo ni pathognomonic ni sa rabies. However, it may not be seen even though if it is pathognomonic, it may not be seen in kanang all cases of rabies, and we will talk about that later. So, mao ni, ang kaning naa sa left is kanang direct fluorescent antibody test. Kaning fluorescence imaging ni. Okay? And then, because I included this picture because kani manggong DFA kay mo ni ang usually gamiton nga test para pag-diagnose sa rabies. However, kanang pwede ra ni siya ma-conduct post-mortem. So, i-diagnose, it's primarily based on history and clinical signs because kanang ang kalisod pud lagi ani kay mo lagi it can look like anything, basically look like any other neurologic disease. So, no changes in hematology or serum profile. It's very difficult lagi pod kay kanang dili nimo di ka um maka come to a conclusion with just blood work. So, you can also conduct CSF analysis pero dili siya kanang even if makakuha ka og normal nga results sa CSF analysis, it does not rule out the disease. Even though, like, let's say, as mentioned here, CSF analysis may reflect a mild pleocytosis. And then, of course, the DFA test. Oh, by the way, I've mentioned that even though Negri bodies are pathognomonic for the disease, um, it may not it may not be seen in all cases. And 'di ba, DFA, results sa DFA test kay kanang mo man jud na ang makapa definitive sa rabies or at least beyond a reasonable doubt. Even though makita sa DFA test nga naay rabies, ang kaning Negri bodies kay mo show up rin a little bit over 50% of the time when histological analysis ka. And then it's also very variable sa kaning size, number, and morphology. So kanang depends from case to case. So management and treatment, this part is very disheartening. So no specific anti-rabies agents are useful once clinical signs or symptoms develop. So same pud ni sa kanang sa any other species nga maka-develop og rabies. Instead, ang buhaton na lang jud is palliative management. That's only if the owner wishes to keep the animal alive, and there are also factors nga kanang which can help us decide kung unsa ba jud ang kanang need buhaton kay first let us discuss unsay buhaton for palliative management. So usually kung mag-manage ka sa horse nga ay rabies, so you can try and help kanang ease the situation a bit by addressing thirst and dehydration. So and then maghatag meds for fever or anxiety, and then ipakalma na to ang animal, ipakalma na to ilang fear, then restlessness or agitation, and then we may also try to ease their seizures and pain. Ang problema lang is, well, it may be just a shot in the dark kay kanang in the end cardiorespiratory failure magyapon. So pag palliative treatment ta pag palliative treatment ta og mga horses nga kanang grabe na kay severity, maabot ra gyapon sa wala. So it is suggested that um, affected horses should be euthanized. Kanang although kanang pwede maka-recover, there are references which state that um animals can recover from rabies. However, it is extremely rare. And then grabe ka intensive ang treatment jud ani. And then kung the factors that I mentioned that can help us decide whether or not to save an animal kay is if vaccinated ba ang horse. If previously vaccinated ang horse, then it is more likely to survive. And then which it will help us think that the treatment is worth it or nana. However, euthanasia jud kasagaran when it comes to rabies. So, prognosis, kung moigo na gani ang rabies and then magpakita na og clinical signs, and of course dili man jud nato mabasta-basta og detect ang rabies before makita ang mga clinical signs, it is invariably fatal. Within any age, it is invariably fatal. Di ba? Rapid man jud ang katong ang onset ang progression, sorry, sa clinical signs. And I've mentioned na ang speed at which the virions travel up the peripheral nerves kay 3 millimeters per hour. That's no time at all. Come to think of it. Um, and even though I've mentioned nga kanang rare ang survival, there is a window of survival from 2 to 5 days or 2 days to 2 weeks, depending on the reference. So kanang even though nasa window of survival, it's kanang, as I've mentioned, kanang you have to be very heroic with the treatment, and there is most likely mapunta ra sa wala. Incubation, onset, and survival relates to the dose and the viral strain, host immune status, and bite wound location. So, as mentioned previously, daghan og factors nga kanang maka-affect sa survival sa horse. So, prevention. Thankfully, even though grabe ka grim ang situation kung magka-rabies na ang patient, there are there is a preventative measure for rabies in the form of the rabies vaccine. So it is one of the 4 core vaccinations for horses. So apila ni siya rabies, kanang Eastern equine encephalitis or Western equine encephalitis, then tetanus and West Nile virus. So it is an excellent immunogen, and these vaccines induce a strong serologic response after a single dose, and then mulas ni siya for 12 to 14 months ang iyang protection. So, kasagaran sa mga, no, not kasagaran. All of the rabies vaccines in the market are inactivated tissue culture vaccines. And then, pwede siyang monovalent or in combination with other antigens, like same aning 4 core vaccine, kaning core vaccination. So this is a vaccination schedule from a well-known brand here in the Philippines that that is applicable with many species. Or specifically, I'm talking about Rabiesin. Muna ang vaccination schedule from sa Rabiesin. So let us direct our eyes diri sa horses na row. So kanang if the horse is aged less than 6 months, maghatagtag ka ng one injection from 4 months of age, followed by a second injection 1 month after the first injection. So from 6 months of age, one injection rasya, and then annual ayang booster. So usually, kung mag-vaccinate ta og adult horses kay hatag ta og a single dose and then revaccinate annually. And then if kanang pregnant ang mare, dili ta kahatag pero kanang pwede ra ta maka-give if kanang maghatag ta before breeding or mga 4 to 6 weeks before foaling. Okay, so pwede ta kahatag og actually yes, pwede ta kahatag og kanang immunization from 4 months of age. Yeah, if kanang ang mother kay vaccinated, kanang dapat kanang 9 months of age ang katong foal before ta maka-vaccinate kay kanang dapat pa mag-eliminate magud ang maternal antibodies. So, in conclusion, rabies is a rapid acting viral disease that carries a very high fatality rate. However, it can be easily prevented against with vaccination. So, moral of the story, vaccination is very important. Here are my references. Thank you.